Dear editor, I'm truly honored to have this opportunity to share with you my research titled Remimazolam and Postoperative Delirium in Patients with Hyperlipidemia, a retrospective cohort study with Target Trial Emulation Analysis. Hyperlipidemia exacerbates postoperative delirium risk via neural inflammation. However, suitable pharmacological interventions to mitigate POD in this population are lacking. Remimazolam has been shown to reduce perioperative stress and modulate neuroinflammatory responses. We aimed to investigate the effect of remimazolam on the incidence of POD in surgical patients with hyperlipidemia. This retrospective cohort study enrolled 1,123 patients with hyperlipidemia who underwent surgery under general anesthesia with and without remimazolam at a single institution. The primary outcome was the incidence of POD within 3 days postoperatively. This study utilized a target trial emulation framework, which enables better control of confounders and causal inferences to explore the impact of remimazolam on postoperative delirium. We also investigate the dose-response relationship between remimazolam and POD. The incidence of POD in the remimazolam group was 13.8%, which was 7.2% lower than that in the non-remimazolam group. Additionally, the severity of delirium and the incidence of cognitive impairment 6 months postoperatively were lower in the remimazolam group. The target trial emulation further confirmed the protective effect of remimazolam on POD, delirium severity, and the incidence of cognitive dysfunction at 6 months postoperatively. Dose response analysis showed that the incidence of POD significantly reduced when the total dose of remimazolam was over 10.29 milligrams, or the maintenance rate was over 0.51 milligram per kilogram per hour. In conclusion, remimazolam significantly reduced the incidence of and severity of POD in patients with hyperlipidemia and improved cognitive function at 6 months postoperatively.